Christine, we've known each other a long time.
Yes, we have.
Can you tell us who you are and when you graduated from BUSPH?
Yes. So my name is Christine Lamoreux, and I'm Swedish and French, but I was born and I grew up in Luxembourg. And I graduated from BU in 1996, so a little while ago now. And that was in health services.
But at that time, international health was something
Yes.
where you could take some courses.
Yes, I took 2 certificate courses. One was in international health, and the other one was management methods for international health, which were really interesting. And that's. But I graduated in health services, and since then I've been working in international health.
Good. Well, maybe you could tell us about what you've been doing since you graduated before you joined WHO.
Yes. So upon graduation, I became, for one certificate course, a resident tutor for the management method for international health. And then I worked with you, Richard, and Dennis from the Harvard School of Public Health on a research project and paper on the rational use of drugs. And at the same time, I was volunteering in Cambridge with 2 community organizations, one with the Haitian community and one with the Central American community. And soon after that, I was able to join a Danish NGO and worked for 2 years in Armenia in primary health care in the mountains in the southern part of the country.
So I remember in Boston you could work with the refugees because you spoke you spoke French already.
Yes.
And Spanish, I think you improved your Spanish skills.
Yes. And actually, when I was working in Armenia, I was rehabilitating clinics, and we had to build a latrine. So I called Joe Anzalone, and he faxed me a whole chapter on pit latrines. So that was very useful.
Very good.
And so
did you learn Russian in Armenia?
I did a bit, yes. No, it was great. And right after Armenia, I went to Tajikistan with the same Danish NGO and worked on the water and sanitation. And I was doing the health education part of it, so there I improved my Russian. Right after that, I decided to stay in Central Asia, and I went to Afghanistan, where I spent 3 years, and that was during the Taliban and right after the Taliban. And in Afghanistan, over those 3 years, I worked for NGOs and different UN agencies. So that was also very interesting.
This was in Kabul or outside in the
it
provinces?
It was a bit everywhere. First year was in Jalalabad, so in the eastern region of Afghanistan. Then I went up north to Mazar-e-Sharif, and then northeast Taloqan, and then I was able also to go to the south to Kandahar and Helmand. So I traveled quite a bit, and very, very interesting.
All dressed up with a hijab?
Yes, all dressed up and then hidden under my veil, and but it was quite different during the Taliban and after the Taliban. And,
I'm sure.
But very, very interesting. And then after Afghanistan, I worked in Burundi for a year on a nutrition program with a French NGO, Action Against Hunger. So I was able to travel around the country because I was coordinating this nutrition program and also a very interesting project to work on. Right after that, I joined WHO, and it was as part of a 2-year competency-based learning project or program called the Health Leadership Service Program. So the first year on that 2-year program, I spent in Djibouti at the country office, and there I worked on nutrition and IMCI, integrated management of childhood illnesses. After 1 year, I was transferred here in Geneva and started working with polio, the polio eradication program, and that was in 2006, and since then I've been working with the polio eradication program here in Geneva.
And I remember when you started, you were starting with multiple short-term contracts.
Yes.
Has that situation improved, or are you still on these revolving short-term contracts?
No, now I'm what they call fixed term, but that's one thing with WHO is that you do go through short-term contracts upon being hired initially, and it gives a bit of insecurity in terms of jobs, but eventually you manage to find a niche, and so that's been sorted.
Good.
Yeah, but so I've been with polio for the past 8 years. And what I do with the polio eradication program is I wear two hats. So one is...
You mean you do two jobs?
I do two jobs, yes. So one is
common occurrence.
Yes, and multiple jobs in some cases for people. So on the one hand, I do very much a desk job. I do data analysis, working with surveillance, mostly AFP surveillance, and doing risk analysis, risk assessments, and then desk surveillance reviews of countries in terms of the AFP surveillance. And that's quite, I enjoy that a lot. What I do as well is direct country support. Helping the country do initial case investigations of polio cases, then supporting the country in developing their own response plan, and then helping the countries to set up the initial immunization country, mass immunization. And in polio, it's house-to-house campaign, so that takes a lot of resources and time and preparation. And then also doing field surveillance reviews. So I do that as well, direct country support. And for example, over the past couple of months, I traveled to Cameroon, where I did an investigation of a polio case. Then I went to the Philippines to be part of the Regional Certification Commission to certify that the Western Pacific region of the WHO is still polio-free. And then I've just come back from Jordan, where I set up a database for polio and AFP in response to the outbreak of polio in Syria. So it's
and AFP is jargon for in the polio world?
Yes, it's acute flaccid paralysis.
So
yes,
it's any condition that looks like polio,
exactly,
but might or might not be polio.
Yeah, and that's what we base our surveillance system on, AFP cases, yes.
Good. And in terms of the work that you're doing now, were there skills that you didn't learn at BU that would have been useful to you? Thinking about other students who are coming through, what other courses do you wish you'd done that you didn't have time to do, as it were?
I think in my case maybe a bit more. I mean, I did epidemiology, but I think I would have enjoyed doing a bit more of that. But in general, I think it was a very well-rounded program. And so I learned a lot. And in fact, one advice probably I would give to students is to learn, to study hard, but to learn as much from their fellow students, because especially those coming from abroad, because they are oftentimes mid-career professionals and they have a lot of experience. And what I found personally interesting is to find out how they would apply what they learned in theory at BU to their jobs, how they would use the theory in their job back home. But also learn a lot from, or try to find out from the people who teach you how it is that they actually applied what they teach in theory. So I learned a lot from actually talking to people and to learn about real life experiences, and so that's something that I would advise them to do, is to learn from each other. Another advice, something that I realized, is languages. So if the students haven't done that, is to invest in languages, especially for those who want to work in Africa, because French is nearly indispensable in Francophone Africa. And oftentimes in organization it's a great asset to have, but oftentimes it's a requirement in international organizations. So languages is definitely something to invest in. Another thing that I would invest in is, or that I realized very early on, is that a project or program is only as good and sustainable as its management is. So you need initially a very solid proposal, you need good bookkeeping, you need sensible HR management. And even though you might be really interested in epidemiology or maternal and child health, you really need to have those tools, and that's something that BU gave me. I learned a lot from management sciences for health and little tools and tips that really helped me in the day-to-day management of my programs. So that's something that I think might not be that immediately that interesting for MPH students, but it's really, really indispensable. And we see it even here at WHO. Maybe the one thing that I would have benefited from at BU is to learn more about the landscape, the public health landscape in the wider world. So more about what's out there in terms of NGOs, national NGOs, international NGOs, international organizations as WHO, UNICEF, the International Red Crescent, Red Cross, the Federation, CDC Atlanta. How those organizations interact with each other? What are their mandates? What are the, basically how they interact and what their mandates are. And that's something that I discovered by working with them. But maybe, I don't know if BU does it now, but to have a few lectures on how it is out there. Mm-hmm. And I think it's worth for students to learn about that and also to make contacts with people who are in those organizations so that they know already very early on where to go, where to look for in terms of jobs and where to find the information which might help them in their job search.
Thank you very much. That's very useful. In terms of one other area, we had quite an emphasis on the social and behavioral aspects. Mm-hmm, mm-hmm. And it was some students really took to it, other students felt it was an obligation, an imposition, and that sort of thing. Where do you come down on this? How important do you think the social and behavioral aspects of public health are, and in your experience?
I found it really interesting, and I think it's really important because what I realized, I mean, public health is about the individual, is about the community, and we might come as public health professionals. We come in international health. We come to communities with experience, with knowledge, with tools. But we need to be able to adapt to the communities we're going to work with because otherwise it just simply doesn't work, and it's a give and take. It's an exchange. You cannot sell your product. I mean, we did social marketing. You cannot sell your product if you don't listen and observe the community you're going to work with.
Good. Now, working here in WHO, I've found that every decision has a technical and a political aspect. Mm. Now, polio, I think, is one of the sort of examples of where politics and technical issues interact, both at an operational level, but also at almost the strategic highest level. I wonder if you could talk about the interaction between politics and technical issues, and how you feel BU could maybe do that better, to prepare students better for that, or whether you think that just comes from experience of dealing with politicians at a later stage of your career. You're
right. It's difficult to teach, but one must be aware of it, and it can come across any kind of discussion you had with people who teach you or with people who come and give lectures at the university. With polio, it's a fascinating world because you deal with the individual, with the case, the child who has polio. You have to do research on developing vaccines. You deal with partners because it's a partnership, and you deal with politicians at the national level. You deal with donor agencies. So it's a fascinating world to evolve in. It's also a difficult world because depending on where the outbreak is, you will have you have different way of presenting it. I worked a lot with Francophone Africa in polio eradication, and with countries like Mauritania, when you have an outbreak, the country is very open about it and deals with it. When there was an outbreak in the Russian Federation and with Tajikistan, we had a very, very difficult time in terms of of dealing with it. Now in Syria, it's a bit the same thing. We have the government, and then we have the opposition. We have cases of polio in the occupied areas, and the government in Syria proper. So we are currently having a difficult time organizing campaigns, and we have to discuss with both parties. So it's something that I guess you have to learn by doing somehow.
Now, polio has had a lot of money.
Yes.
Billions spent on it.
Yes.
And yet it carries on and on. Do you feel that you have a long-term secure career in polio elimination?
I hope not.
But the reality is you probably do.
Well, it's been a difficult year. Last year was looking very good because we had 3 endemic countries plus Niger that was infected. The 3 endemic countries are Pakistan, Afghanistan, Nigeria, and then there was only an outbreak in Niger. This year it's been a bit of a setback. We have outbreaks in the Horn of Africa and Syria and other places. And as you say, it's a very expensive program, and there's been a lot of criticism that it's not working quickly enough, and it's not working at all, and we should go back to controlling polio rather than trying to eradicate it. However, if we fail at eradicating polio, if we stop now, then that's it for malaria and for other diseases. There will be no more attempts at eradicating a disease. What polio is now working hard on, and has been for a while, is to work on eradicating the disease, but improving health services, health systems, and improving routine immunization. And in many countries, the surveillance system is based on polio money, is working with people who are paid by polio. So the polio program contributes to other programs as well. In terms of when polio will be eradicated, we are targeting next year, but it's difficult, and people are getting impatient, and understandably so. But we are hopeful. We have to be.
Do you remember during the summer certificate program we had debates at the end of the program,
Yes.
and one of the debates was about elimination of polio, whether it was a worthwhile effort.
Yes.
I don't think you were part of one of the teams doing that debate, were you? Or?
No, but and yeah, it's interesting, and there again, now I'm being very political. I'm saying that it must happen, but it's true. Yeah.
Good. Can I, just a little bit about you? I think you've married a few years ago and you have a child. I see you walking, or one or two?
Two now.
Two now. I see you walking to the nursery school with the baby, sometimes just up the road as I'm driving to work.
Yes.
How do you find having a family life and such a demanding international career?
It's a bit hard, because I have a 6-year-old and a 19-month-old, and traveling so much takes a bit away of the family life, but I've managed to juggle, to balance, so it's okay. And then my 6-year-old is very understanding and very interested in what I'm doing, so it's feasible. And I think WHO, at least my supervisors, are very accommodating, and my colleagues as well. So it's feasible, and I would really encourage people who have a young family to travel, not to be scared of going and working in Asia or Africa with young kids, because it's feasible, and for those of the students who are interested in working for international organizations who aim at working with WHO, UNICEF, I would really encourage you to start with NGOs, to get your hands dirty, and that's also feasible with a young family.
Very good. An understanding partner or husband is also...
That's helpful.
Good.
Yeah.
Thank you, Christine. Last couple of questions. What about messages to the faculty? Because, as you know, I'm going back to teach there.
Yes.
What do you think I should do better in terms of teaching the next generation of students, the people who will come up to replace you?
I think conveying the message that there's a lot to do, and I think, as I said, getting your hands dirty before aiming at big organization is really important. I learned a lot from you, Richard, for example, from simply from your work, from what you explained and relayed about your own work in Zimbabwe. That was very inspiring and very useful to be able to translate the theory into practice, and I think that's what BU does very well. I was mentioning the management tools, and I think that's really important in public health. Too many programs have failed because of poor preparation and management and sustainability, and I think that's one thing that needs to continue with BU. That was very, very good. And again, understanding the landscape, what I call the landscape, and I think it's a very complex world today in terms of public health. Many actors are in the field, and as you mentioned, politicians, national governments, there are many interests that might be conflicting at times, and I think that the students need to understand that. So there is definitely a niche that can be explored if it's not already explored at BU.
You took the health systems research course
Yes.
with Sarah Richards and me.
Yes, I did, yes.
Was that process and has that been useful to you, or
Yes.
was that more sort of background information that helped you assess proposals? And
I think it was definitely useful. I think Sarah was just starting there at that year when I took it, and probably it's evolved, but it's definitely something very important to proposal writing and how to frame ideas. I think that's really important. Yeah.
good. Any final words you'd like to give, or have we covered everything?
Well,
I know you've made some extensive notes.
No, but it's just I guess I wish I could take the course again.
Good.
That's it.
Good.
Yeah.
Thank you very much, Christine.
Thank you,
Thank
Richard.
you.
Thanks.